Good evening. My name is Jim Gierach, and welcome to Chicago's War on Drugs. This is the 10th edition of the program. Today is Tuesday, June 6, 2017. First, before I introduce my guest, I'd like to point out that this series of 13 programs is being brought to you by Azteca Baseball League, a nonprofit organization that can be reached at the addresses shown on the screen. We have taken up each of these last 9 shows, the issue of which is worse, drugs or the war on drugs. And there's no right or wrong answers on this program, but an attempt to open a dialogue to discuss the war on drugs and whether we should be adjusting it in some fashion. Tonight I have the pleasure of having Toni Preckwinkle, the president of the Cook County Board, with me. She's also served a good stint as an alderman from the 4th Ward.
And 19 years, yes.
19, and done very honorably in both capacities. So I thank you very much for joining me tonight.
Of course.
Chicago's war on drugs. This past weekend we've lost 8 lives, 27 people shot, another typical weekend really with too much violence. The superintendent of police in Chicago says that roughly 80% of the violence is being driven by gangs fighting over drugs.
Territory to sell drugs.
And correct, territory to sell drugs. And we keep groping for solutions, ways that we can reduce violence, reduce prison populations. And one of the areas that I think the Cook County residents have been very happy is the work that you've done with the Cook County Jail. We typically have run incarceration rates of about 10,000, and I think you've made a dramatic change in that. Why don't you tell us about that?
Well, I think the first thing our viewers should know is that criminal justice is an important part of the county's business. 46% of our budget is health care, and 41% is criminal justice. Public safety. So that's 87 cents out of every dollar that goes into one of those 2 buckets, 46% on public health and 41% on public safety. Now, we run the largest single-site jail in the country and one of the largest unified court systems in Cook County. Historically, our jail population had been about 10,000 plus or minus on a daily basis. And shortly after my first budget cycle, which was very difficult, we brought people together in the county in substantive areas, one of which, of course, is public safety, and said, what are we doing, how can we do it better, and how are we going to measure our progress? So we brought together the chief judge, the public defender, the state's attorney, the sheriff, and the clerk of the court, the stakeholders in public safety, and asked them, what is it we need to be doing? And the universal view was that we had too many people in our jail accused of nonviolent crimes. Now, local jails are different from state prisons. Local jails are places of pretrial detention. And our prisons are places where people go who are convicted of crimes. So overwhelmingly in this country, our local jails are filled with people who are awaiting trial. They have not yet been convicted of the crime of which they're accused. So the 10,000 people that we had in the jail on a daily basis in 2010, of those 10,000 people, 7% were serving a sentence, usually for a misdemeanor. 7% were serving a sentence. 93% were awaiting trial. As I said, our local jails are places of pretrial detention. So 93% were awaiting trial. Of the 93% that were awaiting trial, 70% of them were awaiting trial for nonviolent offenses. A lot of them, you'll be interested to know, drug offenses. Possession of small amounts of marijuana or controlled substances like heroin or cocaine or methamphetamine. People were accused of drug offenses. They were accused of prostitution and shoplifting, things people do to get money for their drugs. They were accused of not paying their child support, not paying their traffic tickets. The local jails in this country, and the prisons too, are poorhouses. They're places where people who are too poor to post their bond end up awaiting the disposition of their cases. So, 10,000 people on a daily basis. And we worked with the stakeholders for 2.5 years. Everyone had agreed that we had too many people in the jail accused of nonviolent crimes. And at the end of 2.5 years, we still had 10,000 people in the jail. So I asked the Supreme Court for help and support. I pointed out that the courts in this state are their responsibility, and that we had a commitment of all the stakeholders to do something about the jail population, and nothing had changed. I sent them a letter asking for their help, and at the same time sent it to the local newspapers, which they weren't very happy about. But 2 months later, they brought together the stakeholders, and we've been meeting. That was the November of 2013. We've been meeting pretty regularly ever since, initially monthly and now more like quarterly. But we focused on bond court because that's the port of entry into the criminal justice system. And what's happened since we really got going on this in 2014 is that we've seen a big change in how people accused of nonviolent offenses are treated in bond court. Before we really got started on this project and we had 10,000 people in the jail, a very modest percentage of people who came before a judge got released on their own recognizance, that is on a promise to show up for their hearings and trial, or who got electronic monitoring, a very small percentage. I think it was less than 20%, about 19%. And now, after working on this for the last 3 years, nonviolent offenders who come before the judges, about 55% of the people who come before the judge are released on their own recognizance or electronic monitoring. So more than half of the individuals who come into bond court. And what we've seen is a dramatic reduction in the number of people in our jail. The number of people in our jail is now closer to 7,500, so we've seen a 25% reduction in the jail population. And the proportion of people in the jail who are serving a sentence has gone up, so it's now 14% rather than 7%. And unfortunately, one of the unintended consequences of this is that people accused of more serious crimes are now a higher proportion of the jail population, or those serving sentences are a higher population, both. And the jail is a more difficult place to manage and to work. But fewer people accused of nonviolent crimes end up spending the period between their appearance in bond court and their hearings and trial in the jail, and that's a really good thing. They get to be home with their families, to go to school, to go to work. And we've seen very modest rates of noncompliance. About 3 or 4% of the people who are out on bond or on electronic monitoring don't show up for their hearings or are accused of a new crime while they wait the disposition of their old one.
Now, changing the subject a little bit, because I think that's certainly a success, but I saw something else that you were involved with that I thought was another success, and that's back on the 40th anniversary of Nixon's declaration of a war on drugs. You were in the Daly Center Plaza on June 17th, 2011, saying that there was something fundamentally wrong with the war on drugs, in that it had such a law enforcement emphasis to it, as opposed to health care.
Well, you know, we have a public health crisis in this country around substance abuse. That's surely true. But we need to treat that in our public health system and not in our criminal justice system. You know, we have a country in which we have 5% of the world's population and 25% of the people in the world in prison. 5% of the population, 25% of the people in the entire world in jail or prison. So unless you think Americans are more likely to be criminals than people elsewhere in the world, we're doing something terribly wrong. And that jail population, that prison population, is driven by our drug laws. And those laws criminalize substance abuse and addiction rather than treating it as a public health crisis, and disproportionately impact black and brown neighborhoods. You're much more likely in this country, if you are a substance abuser, to be arrested if you're black and brown than if you're white. And actually, about 8% of the people in this country, across every race, whites, blacks, Asians, Latinos, about 8% use illicit drugs. But the arrests for use of illicit drugs disproportionately fall on the black and brown communities.
You mentioned the disparity in the racial execution of the war on drugs, and here is an article that appeared in the Chicago Tribune a number of years ago, reporting on a study that African Americans in Cook County were imprisoned for drug offenses at 58 times the rate of white people, the 7th worst racial disparity among large counties nationwide. That unfortunately hasn't changed, I don't think, a great deal. When the war on drugs was started in 1971 by Nixon, we had a prison population of 300,000 people. Jump forward roughly 40 years, and we now have an estimated 2.3 million people behind bars. One other interesting thing I'd like to throw out for you to think about, and that is that I didn't realize, I was a former drug prosecutor and homicide prosecutor in the state's attorney's office of Cook County in the early 70s. And the war on drugs was just starting to cook at that time. And the best heroin we had in Chicago and basically the country was 2% pure. 40-some years of drug war, we now have 90% pure heroin across the country. And I asked myself, well, why did we start this war on drugs? And of course, Nixon's Holderman, actually John Ehrlichman, said that we knew there wasn't really a big drug problem, but you understand what I'm saying. We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and blacks with heroin, then criminalizing both heavily, we could disrupt these communities, Ehrlichman said. We could arrest these leaders, raid their homes, break up their meetings, vilify them at night, night after night on the evening news. And so the intention right at the outset, according to a senior advisor to President Nixon, was a really poor purpose to begin with. And it's unfortunately worked. But one other thing I want to add, and that is I started attending conferences at the Commission on Narcotic Drugs in Vienna as part of the long-term efforts I've made to try and change drug policy. But it was there that I learned that in 1961, the United Nations passed a drug treaty called the 1961 Single Convention on Narcotic Drugs. That convention required each nation to go home and to criminalize the recreational use of drugs. And it put drugs in a schedule. Schedule 1 attached to that treaty has marijuana and heroin in the same schedule, a obviously ridiculous classification. In that Schedule 1, the gist of it is that these are drugs that have a high propensity of addiction and that have no medicinal value. And of course, we know that for millenniums, marijuana has been used as a medicinal product. But the last ingredient I'd like to add, after going to about 4 years annually to these commissions on narcotic drugs in Vienna, I learned each year more and more synthetic drugs were being invented by drug cartels because you can't outlaw something that didn't exist before. So the first year I go in 2012, there were 40-some new synthetic drugs invented. The next year it's 50-some. The next year it's 100-some. And the last year that I went, it was 300 new synthetic and drugs, mind-altering substances, to avoid the prohibitions that were put in place on this war on drugs. And then the last significant thing is that the United Nations reports itself estimate that 3.5 to 7% of the population of the world use illicit substances annually, intentionally altering their mental consciousness. Here in the United States now someone will go home and have a glass of wine or smoke a cigarette or chew a candy bar or smoke a marijuana cigarette. We as Americans, we as Chicagoites, we as Illinoisans, Cook County residents, need to re-examine this war on drug that has done this harm that we see, these overdoses with people using drugs that they don't know what's in them, that causes these gangs to be fighting over turf and causing so much radical, indiscriminate violence. And because of these problems, and your emphasis on the health approach rather than criminal justice approach, although we need law enforcement as well, of course, I think is just enlightening and helpful to where we are, not just locally, but really nationally on this war on drugs.
Well, you know, I like to tell the story about my daughter, who's college age, and who went to visit one of her friends at Northwestern, and Northwestern is in Evanston. But this is true of college campuses across the country. She said, Mom, I went to visit my friend, and kids were smoking dope on the street. And I said, yes, Jenny. And she said, but Mom, if my friends and I in our neighborhood, you know, went down the street smoking dope, we'd be arrested. I said, yes, Jenny. You know, I have to say I went to college 50 years ago. quite a while ago. But everybody on campus knew who the drug dealers were, and the drug dealers were never arrested. Never. Never. So we have two different standards in this country for illicit use of drugs in public, use of illicit drugs in public. And, if you're on a college campus or if you're in an affluent neighborhood, you're less likely to be arrested for drug possession or drug use than you are if you're in a poor brown or black neighborhood. And actually, Chicago's half the population of Cook County, but 80% of the people in our jail are from the city of Chicago. And the jail population is driven by hyper-policing of black and brown neighborhoods. Early on in my tenure as president, I was visited by a judge that I had helped support. And she told me, she said, you have to understand, Toni, that the police are bringing into my courtroom young people, our people, she meant black and brown young people, for things like shooting dice on the sidewalk and having a couple of marijuana cigarettes in their pocket. So they're, and I'm not defending shooting dice on the sidewalk or smoking marijuana. I'm just saying this is sort of petty antisocial behavior. And in black and brown neighborhoods, that kind of petty antisocial behavior gets criminalized, and it doesn't get criminalized in other communities in our city and our country. And it's led to incredible incarceration rates for black and brown young people, and a huge, as you said, huge increase in the number of people in our jails and prisons. And I think the irony is that we're at a point in this country now, finally, where those who are concerned about what it costs to imprison people, and it costs imprison and detain people in our jails, and it costs us in Cook County $162 a day to keep somebody in jail, $162 a day. And those who are concerned about the social justice impacts, that is the disproportionate impact of our criminal justice system on black and brown communities, have come together to say we have to deal with possession of small amounts of marijuana. We have to deal with the sort of petty antisocial behavior. We have to deal with addiction and substance abuse in different ways, rather than just detaining people, rather than arresting people and detaining them in jail or imprisoning them.
Toni, if I may, I think that this war on drugs is also affecting the very basic relationship between police and our communities, where people see crime and maybe they're involved and maybe they have marijuana in their pocket and don't want to go tell the police that there's a crime that they just saw or that's happening because of some consensual drug use. We have heavy-handed police force used too often. Discriminatory stop and frisk as to who's thrown up against the wall and empty your pockets out. And when you have that friction between the community and the policing force, it destroys the ability to solve crime. Our homicide clearance rate in Chicago has dropped to 26%.
Which is less than half of the national average.
Yes, and
the national average is in the 60s, somewhere in the mid-60s.
Sure.
And in Chicago, it's less than half that. This is the closure rate for homicide cases.
In a gunshot case in Chicago, you have a 95% chance of getting away with your gunshot.
With shooting somebody.
Shootings.
Right.
Shootings.
Well, I agree with you that the war on drugs has made it hard for police and communities to come together. But I think that we have deeper problems, and what you've suggested is the war on drugs was motivated in part by racism. Your quote from Ehrlichman in the 1970s in President Nixon's administration. And I'm not going to argue with that. I think that's true. And it's surely reflected in the impact of drug use in drug prosecutions. You're much more likely to be prosecuted for a drug offense if you're black or brown in this country than if you're white. And as I said, the rates of usage of illicit drugs are pretty much the same across every racial demographic. It's about 8%. But our jails are filled with black and brown people arrested for drug offenses. And that's a reflection, I think, of racism, just pure and simple. We continue to struggle with racism in this country, and it's reflected in one of its most glaring aspects in our criminal justice system.
I think we have to fix the war on drugs in order to fix the racial difficulties we have in so many of our communities across the country. It's just the new Jim Crow, as Michelle Alexander wrote in a very good book. While we're talking about the two big expenses of the county, one you mentioned is what we're paying to incarcerate people, but the other is there was a press conference held by Reverend Jesse Jackson last summer where he had the director of Illinois Blue Cross Blue Shield with him and statistics from the University of Chicago Crime Laboratory, in which they said that the cost of bullet hole health care in Chicago is $2.5 billion. There is no health care system, Obamacare, Trump care, that can afford that extra credit burden that's being placed on health care across the country.
Well, we have a world-class trauma center at Stroger Hospital, which is our flagship hospital in our health and hospital system, world-class. And we treat lots of trauma victims, people who have been shot. And, it's very expensive to treat people in trauma care, very expensive. And the irony is that it costs more to treat somebody who lives than dies, because often they need treatment for the rest of their lives. They're so incapacitated by their gunshot wounds that they need intensive medical care for the rest of their lives. So, yes, the violence precipitates a healthcare crisis in addition to a crisis in the communities where violence is so prevalent.
We are making some progress in the war on drugs, and public opinion is changing. We have 83% that now say the war on drugs is lost, 4% saying that it's being won. We have in Illinois 61% that are now in favor of legalizing recreational marijuana. I think many of those people not saying to do that because they're in favor of drug use, but in recognition that consensual behavior between adults is not something that should be a priority for law enforcement. Law enforcement should be protecting people from criminals who do bad things. We also now have 8 states that have legalized marijuana, 28 states that have legalized marijuana for medicinal purposes. And we have Representative Kelly Cassidy and Heather Stein, Senator, who have introduced a bill to now move, hopefully, Illinois in the next step. And then we'll see how that plays out in the next session of the legislature. They're busy right now.
I have always supported decriminalization of marijuana possession. I think that we waste a lot of time on enforcement around marijuana possession, and we should focus, as you said, on violent crimes. If we put as much energy into trying to find the perpetrators of the shootings in our neighborhoods as we do on trying to catch people for low-level drug offenses, we'd be a lot better off. And as you point out, we live in a country in which you are virtually assured of getting away with shooting somebody, at least in Chicago, and 3/4 of the time we don't solve our murders. So we've got some real challenges in terms of dealing with violent crime, and I would rather our public safety and criminal justice resources focus on violent crime rather than low-level drug offenses.
Well, it's been a real pleasure having you here on the show. I view you as one of the enlightened, progressive
Thank you.
folks in Illinois and Cook County politics. And I'm sure that you're going to continue in the same way to lead us out of this morass and helping people get over the idea that drug policy reform is not a choice between Al Capone prohibition or reckless candy bar drugs out of a vending machine. They're individual programs that people and politicians need to look at to determine whether this is going to help people, not putting a one-size-fits-all prohibition in place, which we've had basically by the Controlled Substances Act, by UN drug treaties that mandate that, and rather we should give politicians the elbow room to try and experiment with new programs and see if we can't make the public safer and more healthy. Thank you for being with us.
You're very welcome.